Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
I have a question here about a 14-year-old boy. The parent says, my son's shorter than the rest of his class and showing no signs of puberty. Should I be worried? They want to know.
The question is, you don't have to worry as long as he's not worried. Boys go into puberty at all different sorts of stages, and a boy going into puberty late is very common. What happens is that all children get a growth spurt when they go into puberty. And so what will happen if you haven't gone into puberty and you haven't got that extra surge of testosterone is that the boy will carry on growing at the rate that he was growing before all his friends went into puberty.
Yeah, so the others are shooting up around him.
The others are all shooting up. Now, if he's getting bullied or if he's feeling very self-conscious, he can be helped by going to see a paediatrician who's a specialist in puberty and endocrinology, and giving a little surge of a little boost of testosterone.
Does that start the process?
Well,
it
kick-starts the process,
right,
and can actually make him feel a bit more kind of masculine and give him a bit of a growth spurt. But many boys are quite happy just to kind of chill out until they're 15 or even 16, because it usually just happens on its own.
And boys aren't usually as aware of that development as girls are.
No, I mean the range in heights, I always found it very interesting. At about 13, the range in heights of boys is massive. Because you've got those who are 11 or kind of going into puberty, and you've got those who clearly at 14 are showing no signs. So, and they're kind of used to it, I think.
And not uncommon at 14
No,
then?
not uncommon.
So they're worrying unduly?
Yes, usually. I mean, if it's always worth just getting your doctor just to check out your child, just to make sure that everything is absolutely normal. But most of the time it's going to be something that will happen in time.
Great advice. Thanks, Sue. Well, if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.